Last year, probably about this time last year, the California Healthcare Foundation, we commissioned some research to understand some lessons learned with open data. In fact, Cheryl Wald, if you don't mind standing up, Cheryl. Cheryl Wald, with the researcher who conducted this assessment for us. She's here with us today, as evidenced by the fact she just stood up, and also really participated heavily in leading for this event and the planning for this event, and also planning the work group that Daniel had talked about. So we're really thankful for Cheryl. And by the way, if you have good questions or any questions on open data, Cheryl's a really great resource. But anyway, our goal with this, commissioning this research was really to sort of assess lessons learned as a way to help the state and others within California to build on the good work that's been done elsewhere with open data and with open health data. And just really briefly, some of the key lessons learned that we really sort of took to heart. One is, and this was mentioned earlier. This is really important. The federal government's doing a great job on this. Is that user-centered design and the interface, they matter greatly. If you're going to build a data portal, it's going to be by its nature a very sprawling website. If a data portal that's hard to use really does no one any good. So that matters greatly. And Brian mentioned that. It's important, we think, to start small. There are a lot of data out there that can be freed, even if you're talking about de-identified, aggregated data. So it pays to start small, to learn from what you're doing. And a third one is that open data, and I mentioned this earlier, it really does need to be a partnership with innovators outside of government. They could be researchers, they could be policymakers, they of course could be entrepreneurs, they could be advocacy, they could be journalists. But it's not incumbent on government to create the innovations or to sign a contract to create that innovation. It's a handoff. It's building a partnership, and we're going to talk a little bit more about that. Anyway, that's what we discovered. But we're privileged to have with us here today some pioneers from elsewhere who've really been in the trenches, not only thinking about open data, but doing open data. So rather than focus on what we've learned, we're going to turn it over to them and talk about and listen to what they've come up with. The aim is really to make this a conversation. So I encourage you to participate in that conversation. There'll be some brief comments, 5-10 minutes or so, of intro comments from each of them. And then after that, I do have a lot of questions that I could ask the panelists so that we can have a nice conversation, but I also really want you to, chime in with some questions. So let me introduce our panelists. I should mention that you may see that in your agenda that there are 4 panelists. Us all being good at data, you may count, and you only see 3 panelists up here. Wilma Wooten from San Diego County is kind enough. We had a cancellation a little bit later today, someone who couldn't make it for a panel discussion, and Wilma's comments for the really amazing and interesting work they're doing in San Diego County. She has tremendous flexibility and agreed to be instead on that panel, so she's going to be joining that panel. But we have 3 amazing panelists with us here today, and let me introduce them, and then they'll come up, give some intro remarks, and then, like I say, we'll have a lot of questions. First is Stefan Kanya. Mr. Kanya is the Chief of Staff, the Chief Operating Officer, and the Chief Results Officer for the Illinois Department of Public Health. In addition to many other responsibilities, Stefan is tasked with developing an agency-wide innovation agenda, which includes modernizing agency operations and fostering strategic partnerships. As some may know, Illinois has been a leader with open data. For example, they held a public health data palooza a few months ago. I think it was back in November. And Illinois, too, offers an open data portal, as California is considering doing. And their open data portal was launched, I think it was in 2011. Is that?
Mm-hmm. Sounds about right. Maybe soon, maybe earlier.
Somewhere around there.
Yeah.
Reina Ferrales. Reina is the Deputy County Manager for Performance Management in San Mateo County, California, overseeing countywide performance improvement initiatives, including the county's performance dashboards, process improvement, and benchmarking. She also supports the leadership teams of the Human Services Agency, Health System, and Child Support, among other teams. I'm really proud to say that my own county, I live in San Carlos, California, my own county of San Mateo, like many other local jurisdictions and governments in California, really has begun to embrace open data. And Reina can describe the experiences that they've had of working at such a local level on open data. And lastly, Steve Spiker. Steve is the Director of Research and Technology at the Urban Strategies Council. Spike, he goes by Spike, has research experience in community development, housing, criminology, and spatial epidemiology. He's the co-founder of Open Oakland, a civic innovation organization helping government become more transparent and engaged. He speaks nationally about data-driven decision-making and was chosen as one of Next America City's Vanguard class of 2012 and honored as a White House Champion of Change in 2013. He's a dad, a new dad, right? Is that a new dad, a husband, and a co-author for the new book on open public data, Beyond Transparency, which, by the way, is that book that many of you picked up outside. They're all sold out, so to speak, but I'm glad some of you do have copies. So with that, I'll turn it over to you, Stefan. Thank you.
Well, thank you. I was told we had 5 minutes to just kind of do a brief introduction and try to leave more time for Q&A, so I'm going to try to stick to that. So in addition to the intro, and thank you for that, I'm here to represent Illinois and specifically the Department of Public Health. So when we look at other states, especially New York, which is a shame, I know they're supposed to be part of this and unfortunately had to cancel at the last minute. But New York is, I think, a great model of where Illinois is heading and hopes to continue in that direction, even maybe beyond where New York currently is. I'm sure they're not slowing down. But they really did kind of blaze the path for us, and we're really embracing what HHS has done on the federal scene and what the New York State Health Department has done as well. So in our state, it's a little different than what New York had done, which is our governor back in 2011, I think we began working on in 2010, as a recommendation out of the Innovation Council that he established, was pursuing open data as a statewide initiative and something that would help foster economic development and many other transparency and accountability goals. So our state agency was one of many that was all told from direction at the top, you need to also support this effort, and we're going to launch a statewide portal, data.illinois.gov, and we want every agency to begin populating data sets into it. And specifically, we've got a State of the State address coming up. We want to brag about this, so get as many data sets as you can in there, and let's start figuring this out. So we made a very early push to do that back in 2011 as public health, and for a month or so, it was great. We got a number of data sets in there. We didn't do much with it after that. And what we're doing now, last year, is really kind of doing a bottom-up approach and really reinvigorating our commitment to it. So now, really kind of using it as a public health, population-based approach for disseminating data in support of so many other things we do. So, our innovation agenda, was mentioned, is really a very simple framework of seeking operational efficiencies for the agency. I don't think it's up here, actually. I'm just reviewing it off my deck here. Evaluating our business approaches, making sure we're not, just throwing data up and trying to take outdated processes and getting data out there in inefficient ways. Adopting new technologies, developing an internal culture of innovation. And then externally, our innovation agenda is really focused on fostering strategic partnerships, improving data dissemination, engaging with entrepreneurial community as a specific item, because a lot of innovation happens at that level, especially with non-traditional partners. You heard them mention earlier, Purple Binder necessarily wasn't a healthcare company or somebody with a healthcare background, yet they're providing communities with access information. And then engaging better with academia. So that's kind of the general framework for our innovation agenda, and I think that open data either supports or is at the center of nearly every one of those pillars, so to speak. So excited to talk about some of the lessons that we've learned in the short period since we've reinvigorated our efforts and answer any questions you have.
Just, are these on? Can you hear me okay? Okay, good. Just one quick follow-up question before we move on. So I know you're the results officer. We were talking about this a little bit earlier. And I think there's interest, here in California, we're wondering, how does one measure and quantify the public benefit that comes out of open data? And I don't know whether you've been giving some thought to that. Is it quantifiable? I thought you might have some insights.
So I think from a number of perspectives, it can be quantifiable. In some ways, it can't be quantifiable or directly tied, but that's the challenge of tracking performance metrics and your direct impact. So I should first clarify, as a CRO for our agency, that's not necessarily my job title or another position that I've been assigned to fill, so much as it is an agency designation. So our state is pursuing budgeting for results as a performance metrics tied to budgeting outcomes, or performance outcomes tying it to our budgets decisions as an overall statewide agenda item. And each agency has to have a CRO, basically, that determines how that agency is going to, map the progress of tracking the effectiveness of all their programs, and in general, justifying every state dollar that is spent on that program or federal dollar, and measuring its success. So when it comes to a specific initiative like Open Data helps support a lot of the programs that we then want to go out and secure funding for, sometimes by enabling advocacy organizations to go on our behalf and support, because they have better access to the data and they can do better analysis of where grants are being distributed, et cetera. But then also, I think there are ways, so we can measure it through successes in reduction of health disparities, because there's better analysis of the data through better data dissemination. I think we can also measure successes of open data through operational efficiencies, which is something that maybe isn't going to engage quite the amount of community stakeholders as you're looking at, but certainly will with government watchdogs and funding dogs who we have to fund and justify programs. We can justify that through the open data efforts that we've improved business processes and reduced administrative burden by reducing our FOIA requests by 70%, like state of New York did. So there are other ways of measuring it as well. You can show that you've improved your business processes by providing it in a more usable way.
Great. Thank you. Rena?
So I'm here today to talk to you about San Mateo County and our story towards open government. And part of that is making our data available to make better decisions and to drive towards results. So real quickly, San Mateo County, we're the 14th largest county in California, very diverse community, and in the middle of Silicon Valley. We're in the middle of San Francisco and Santa Clara counties. And as far as workforce and county budget, we're medium-sized budget, 5,300 employees, $2.2 billion budget. So open data for us is part of being an open government. Transparency is obviously one of our highest priorities, but we're working more towards becoming more participatory, engaging our citizens, our residents in the decision-making of government. And part of that is, again, making data available and then managing towards results that will benefit the entire community. There are also tools, a lot more tools available now, technology, where we can be more collaborative with our community by using a lot of online and much more innovative compared to what we had 5-6 years ago. So open government for San Mateo County, we have visioning processes in the community. We just completed our second one in 2008. So we went out and did a number of town halls, did online voting, and came up with our shared vision for 2025, which is a healthy and safe, livable, prosperous, environmentally conscious, and collaborative community. And since that time, our board has approved 9 community impact goals. So when we talk about strategic goals and aligning and making sure that our data contributes and that the data is relevant towards achieving goals, these are the community impact goals that we'll be using in San Mateo County. Now, very recently in November, our residents voted for a half-cent sales tax. And that's part of our story as far as standing up an open data portal. Our board members were very active during the campaign, telling our residents that we will have all of the results of what the money is being spent on. It's going to bring in about $65–70 million a year for the next 10 years for San Mateo County. So it was important for us to be able to show that visually to our residents what we're spending the money on. We also moved to a 2-year budget in San Mateo County, and part of that was that we all were getting really tired of cutting budgets in the last 5 years, and we wanted to focus more time on performance. So we actually our board adopted its first 2-year budget last year, and this year our priority is to focus on performance and getting data to make better decisions. Last year was also very big for us around standing up an open data policy. Our board directed our county manager and our chief information officer to develop an open data policy. It's an administrative memorandum. We also stood up Socrata, an open data portal. We're using Open Checkbook, and we're also building our performance dashboards using Socrata's GovStat tool. You might not see this from the back, but these are our 9 community impact goals under the different community outcomes under Shared Vision 2025. And so related to health is, one of them is increased life expectancy. We also have close achievement gaps and improve affordability. And within these goals, we will have community indicators, and our performance measures in our departments will align to these goals. And this is just a picture of how we intend to use the open data portal. So getting data from all our different departments and from our community partners, putting them into the open data portal, and then visualizing that through the use of GovStat performance dashboards. And then we can have more conversations out in the community and within, across our departments about what's going on in the community, what should we be allocating resources toward, what should our priorities be. And the GovStat tool and the performance dashboards will enable us to do that in a much more visual and engaging way, not just charts and line graphs. So lessons learned, and I know this is a really big deal if we can get open data, an open data portal at the state level, particularly with Health and Human Services, just because of the impacts that it can have with our residents. But really be agile and experiment. This is not a perfect process for us. We stood up the portal. We have some data sets in there, and we have dashboards for Measure A. We have a number of things, and you can easily change it. So it's important to experiment and be agile about it. We also have very strong leadership on our board, and our county manager and a number of our department heads are very data-driven. So I think that's a big advantage for us. And then the big thing that we want to work towards in the next 3 to 5 years is a master client index. And I know a number of, whether it's Illinois or New York, we want to learn from those that have done this, where you're actually sharing data across departments and across agencies, because we're all serving the same people. That way we can provide them the services that they need and improve the community as a result. And then the last thing on here is just having regular updates. I think that's really important to keep the momentum going and to keep progress on track, is to have regular goal reviews and then making sure that we're looking at what works and what doesn't, and that we can adjust along the way. And then, real quick, this is really tiny, but these are the links to our open data portal, checkbook, and dashboards, and his contact information. Garrett Dunwoody, who's one of our analysts in our office, he was our GIS guy from our IT department. He can talk to you about open data all day long. He's not here today, but he'll be here tomorrow to participate in that discussion.
Have you, so, I'm a resident, as I mentioned, of San Mateo County, and certainly plugged in to open data. And I imagine it must be, I was really enthusiastic when I heard that, my own county was doing open data. But it struck me that probably this is a hard concept perhaps for residents to grasp, and maybe also hard to spread the word that you have this portal. And I don't know if you've seen some success or even some lessons that you could learn, share about that in terms of just spreading the word and explaining the concept.
Yeah, when we launched our open data portal, was August of last year. We did a big press release, and we did all of that. I think the approach needs to change so that we go out to the community more to share it, and actually, once we have a lot more data sets there, doing those things like coding events or write-a-thons, help us solve this particular problem, not just engaging from county center, but going out to, we just got great data from our food bank, and it would be great to go out there and share that data and see where we can have more farmers markets or get CalFresh eligibility. We have the lowest CalFresh enrollment rates in San Mateo County, so we really need to, so things like that, I think we need to go out there more in the community.
Sure. Thank you. Spike?
I'm going to stand just because I feel weird sitting and talking. I'm not special. All right, so we're going to talk about open data, what it means in Oakland for a different kind of organization, more at the grassroots community level, and the impacts that we've either had, struggling to have, and where we see open data as far as a change agent in our community. So Urban Strategies Council is a social impact organization that focuses on a number of different issues that affect our communities. We focus on everything from economic opportunity, community safety issues, education, performance of our school systems. And all these things that we do that have a thematic focus, or focus on a sector, often come back down to collaboration, sometimes innovation, and often come down to the data that we use to make the decisions around changes, around performance, around planning. And it's not enough for us to just have data in those discussions. We think there needs to be data that is being used for decisions that improve equity and justice in our communities. And over the 25 years, 26 years that Urban Strategies Council has been doing democratization of data type of work, we realize that there's these 6 things that are really important if you want a strong ecosystem of data-driven decision-making in your community. The first is that data has to be accessible, and that's an easy way of saying it's got to be open. But it's not any use if people aren't analyzing that data in a local context where people can understand it and put it to work. And it's really important you communicate the results. And often in academia, in governments, we do something, but we don't bother to communicate it to people in a way that they can take it and use it. And that's a flaw that we've been guilty of as well. And it's really important that communities have the capacity to take and use data as well. And that's not just a passive thing, it means being present and training and building capacity. And then it's really important as well that you actually engage people using the data. And like, as our San Mateo colleague suggested, that getting out, using the open data as a means to engage is amazingly powerful. And then measuring the impact is obviously key. If we're not measuring the impact of these decisions and these changes, we're missing something. And so it's really important that the communities that are on the end of all the decisions that we make are considered when we make those decisions, and when we consider the plans, the ideas, the things that we're doing. So these are things that are going to impact people, and we need to be mindful about that, even with something as geeky and obscure as open data. And so for us, this is our user base, as well as politicians and other leaders. And so when we set out to rebuild what is our new version of a system called Innovators County, is that we decided that how many people, for example, have used web maps in the audience? They've gone to a website and used some kind of map. Come on, everyone's most. How many people have gone to a web mapping site, especially from, say, a health agency or a government agency, and found the map was okay, but wanted the data behind it, but couldn't get it? Okay. So we feel that as well. And we realize that when we make a web map, it's nice, it's really useful. But what about when it doesn't meet your needs? Then it sucks. It does not meet the needs that you have, and it's suddenly it's rendered useless and obsolete and doesn't meet a valid use case, and it doesn't help. So we rebuilt Alameda County to actually meet that need by making sure that anytime you've made a map and done something with it, you can simply pull a CSV file of that data down. Some of the data is confidential or private and licensed, and so those we can't. But as a rule, everything we put available in this system is really easy to get down and use for people. And so, I just realized this isn't the updated deck at all. Never mind. So what's going to happen is I'm going to ignore the slides for a couple of minutes because I wanted to cover a slightly different angle, and this is the deck from Code for America last week, so I apologize. So one of the things that we realize is that when we talk about this user-centered design approach, is that it's really important to understand the diversity of your users. And for us, it was, our users aren't all policy analysts or all grassroots community workers that wanted that map to show the impact of the health impact in their community. Sometimes they were developers or researchers that wanted the data. And so by thinking more about the various use cases that existed in our community, we could rebuild our system in a way that actually supported those use cases. And so over time, we've changed how we think about data and our ownership and our role with data. And those of you that are in the public health field, which is a lot of us here today, we've been leading as far as getting data out to people and communities for a long time. And in my training in epidemiology in Australia, we were using maps from Cuyahoga County and in Chicago that showed public health issues in that community and maps of that area for a long time. So public health has definitely led with getting information out. But it's also at a point now where we need to start rethinking how we get that information out and how we share that information. And so I think there's one piece that I really wanted to sort of dig into, is that when we talk about open data, we're talking about open data that an individual has collected and maintained, and that individual has a sense of ownership and a sense of responsibility for that data. And when we talk about open data as a policy piece, as an idea, as an agenda, as an advocacy thing, is that we often forget to realize that we're talking about a person, a public servant, at the end of that, who's managed that and has a lot of valid fears about what is this going to do. And often when we have these discussions about innovation and creativity, those are all valid, but in the end, it comes down to an analyst or a management clerk at some level that's managing that really needs to understand and buy into this idea of open data and what it means for them, that it isn't a fear thing and a threat thing, and it's an opportunity for them. In Oakland, after Open Strategies decided to start publishing our data aggressively, we thought that this was important and mattered, and other cities were doing it, and we wanted to do the same thing in our city and make all the effort that we put into every research project that often is funded by the city or the county, and then we go and spend 10% of that budget trying to get data out of the city and the county. We decided that it was important for our local government to do this as well. And the first time we did it, we failed. We tried to get a resolution passed and it got watered down and it became worthless. It was a resolution to plan, to investigate, to check this open data thing out. And didn't yield much. But what happened is that the city started just publishing data. They bought a package through Socrata and started publishing data. And the problem with that is that it wasn't sustainable. As soon as someone didn't like a data set that was there, it was gone. And there's no policy to back that up. And so we, as community advocates, we started lobbying again. And this is a role that if you work for a county or state agency, you can lobby your own agency, but you can also lobby the city government in the town that you live in to do this. And we eventually got this thing passed where the city now has a proactive policy that says open data is almost default, but this is something that we're going to aggressively pursue. And we're seeing really important benefits from this already. And so it's really important to find the angle that matters within your agency or within your city. And that's something that for us was very clear. We had a couple of ideas that we thought would resonate with people that didn't, and we had to adjust and pivot the idea that we were trying to present to our local council members why this thing worked. And I think using a wrong deck, I think I'm going to close with 3 things that we learned that we've seen effective in the county as well in the city. Is that open data can be amazingly complex and powerful and huge, but it can start really simple. A number of cities have started with just a simple WordPress site that allows them to publish and catalog all the data in their communities. Your agency can do the same thing. A number of organizations can help you with this. It's super fast, it's cheap, and it's actually easy to start doing this, turning on the tap, but then engaging with people. And both representatives have talked about the need to engage. And if you have this thing, this is now a really valuable asset that you can engage your staff with and your communities with. But like I said, it's also important to realize that there are people that really think this is going to mess up their integrity, their workflow, their jobs, their security. All these things are real fears, and we have to be honest about them and respectfully deal with those things. So that's kind of a mix of an Oakland experience, and we're on to some questions.
Great. Thanks, Mike. So I'm going to ask one follow-up question of you, and I'm going to harken back to the chapter you wrote for the book, Beyond Transparency. And because I think you have a quote in there that sort of gets at the heart of both the potential of open data and just as well you were talking about the fears, but the concerns that people may have. So this is a quote. It is no longer an acceptable circumstance for local government to make decisions and ask that we simply trust its goodwill and expert opinion. Any elected official must be able to rely on the quality of analysis from city staff and other experts. What open data sets open up is a future where citizen experts can easily provide qualified perspectives on government decisions, analysis, and statements. And so I'm kind of curious, in your work in Oakland, or for that matter, Alameda County, or even San Francisco from what you know, have you seen the beginnings of such involvement, not necessarily from the app developer world, but from concerned citizens and people along those lines?
Yeah, there is. This is essentially what we're doing here is social change, right? This is slow stuff, and often in the innovation space, we want fast change. And it's sometimes hard to look at this and say this is having the impact we want. The previous dynamic is that government will make a decision, do some stuff based on information that they may not release to the public, and then people will get upset about that, make a lot of noise. Maybe government will relook at the issue and maybe not. But you create this atmosphere of distrust where we know what we're doing this thing, and we'll tell you about it. And if people say, we don't like that, this isn't what we want, or we're not sure about that, can we check that? The answer is no, you can't check that because of public security issues or confidentiality issues. But when we change that paradigm and do things like in Oakland, we released Open Budget Oakland last year, and it was a way to look at 16,000 lines of Excel data that was the city's budget. And it meant that when there were questions about city spending at council meetings, the community members that were there knew about this and had access to see the ratio of different spending between departments and the ratio of public debt payments that we had. And all of a sudden, you had the ability for people to actually say, I know what's happening in the back end of this government agency, and I want to ask a question that's informed by facts about it. And so we elevate the level of discussion to, I think that's a crappy idea, or I don't like that, or that doesn't meet my needs, to, I think how you're spending that money there far outweighs this, and this is our concern. And so you change the level of discourse to a level that's actually more positive, but you've actually been proactive in saying, people, you can be informed now. Instead of trusting us that we're doing the right thing, you can be part of that process now.
Great. So, okay, so let's, I'm going to stand up just so I can see if there are questions, and I hope there are questions. So let's open it up. Anybody have any questions they'd like to ask our panelists? Like I said, if not, I have some. Shell, all the way in the back.
So I have a question for Spike. In your experience with Alameda and Oakland, what are a couple of measurements that you have been collecting? What are a couple of measurements that you have been collecting? Is it really?
Okay. Now, I'm sure everybody could hear me anyway, but as you have been on this journey, what are a couple of measurements that you have been collecting or that the city has been collecting to demonstrate the value of open data and the initiatives toward making data more accessible to the citizens?
One of the things that we've encouraged the city to do around this, I think is one of the key things that was already alluded to, is that at the same time as the city starting to publish open data, they've also built out a new records request system for public records requests for FOIA. And we're really excited to see what the confluence of open data and a more efficient online, publicly accessible public records request system means for the volume of public records requests. So it's very hard to quantify this in dollar terms often, as was said, but if we can show that the number of public records requests has decreased because open data has been out there, we know that the city is actually saving money. And we have a system which for the first time is available online, which will allow people to see other requests and hopefully not duplicate. So between the two things, we're really excited about seeing how much time we can free up from people digging up answers and actually doing more productive work. So that's actually the single biggest thing we're excited about seeing change. Otherwise, it's actually an area which we need to work on.
And I know this was alluded to before earlier, New York State has counted up, and I don't remember the details, unfortunately, but they did look specifically at that, and they used that as a measurement. How much money have they saved, or how many hours have they saved by the reduction in Public Records Act requests that they no longer need to fill? So, other questions, please.
Can I add to that just a little bit?
Of course.
Sorry. So one thing I just want to remind everyone in the room, especially those in government, obviously we always have to make the case and justify for any funding of any program. I would argue that actually a lot of the tools that are out there and platforms like Socrata, I mean, it's not the only one, but it's the one that we're using, and we're very happy with it. They're very inexpensive for the amount of social change that you can achieve with it, right? And so yes, you can prove that it's operationally better for you to embrace an open platform, that it can cost or drive down costs, and you can reduce headcount because now you're not fulfilling as many FOIA requests and so many other things, that it pays for itself. But sometimes, like Brian said earlier, you do something because it's just the right thing to do, right? It's better to be more open. This was built in Illinois like I said, out of the Innovation Council, but it was also on the heels of the fact that we had a state where we just threw our governor in jail. And we had a governor who came in, Governor Quinn, who's been in office ever since, and had to prove to our citizens and our residents that you can trust government. And so immediately he launched what they call the Sunshine Initiative that said if it can be FOIA'd, it should be automatically on our website. and then just kind of use that general frame and term. If it can get FOIA, don't make it this complex environment that they have to go through and make them jump through all these hoops. Work towards just providing it on the website, because it's more open and transparent, and then they can hold us more accountable. So it's sometimes it is great because you can show cost savings and efficiencies, and obviously we're pursuing it for those reasons as well. But at the same time, it's the right thing to do, and it shouldn't always weigh it on, are we going to get the most bang for our buck for it?
Yeah, I think that's a very good point. Yeah. Right up here in the front. Why don't we just wait one sec with there'll be a microphone coming your way.
I'm from Illinois also, and we do have we call it Master Patient or Master Person Index, I guess, which is a very important thing I'd love to talk to you about. But I guess my questions are, who is asking for this? How many agencies understand the value of this large potential cross-reference? Where are you with that? I'm kind of curious, and what are the problems, what are the successes you've had?
So we're actually running into this now with public safety realignment, reentry. So we need to be able to track when someone is released, what services they're going to need in the community. So while they're in jail, programming that they've had, correctional health, do they need housing? Do they need a job? Do they need health care? All of these support services, all needed by one person and their family. So we're running up against that now. We're tracking everything manually, so we have to create a single ID. And I was talking to one of our nonprofits last week, and eventually, I don't know where we all are with biometrics, but eventually there needs to be a way where palm print something that just says you walk up and we'll be able to see what services you've had, which department you've been at, so we can better provide services to you and your family. But we're still a ways. I mean, our departments still need to be able to talk to each other.
Yeah, over there.
Hi, I'm Esty Garrity from the California Department of Public Health, and I wanted to ask all three of you if you could give us a sense of the number of FTEs that are required to maintain and support your open data solutions.
Why don't we start all the way at the end and we'll bring it right down here?
So as of right now, we don't have an internal infrastructure that's built solely for open data. What we've done is we've organized the data stewards across our agency. I mean, Department of Public Health has a significant amount of data stored in many different formats and systems. And we have other forms of what somebody might be able to call open data that have been in existence for years. And I would say that there was an interface on our website that people, like our hospital report card, we have an iQuery where researchers and others can query, local health departments can query certain data in certain formats. But the problem there is that it wasn't usable, right? It was they'd have to download it, come back every so often to get it. They just can't connect to it through an API or whatever it may be, and automatically have it pushed out to them. So what we've done is we've built upon and organized internally, for now anyhow, all of our data stewards and have them working together as kind of an internal data team or data group that is helping to prioritize and basically port over the data from either their existing sites or the ones that are stored on their hard drives, wherever it may be, and getting it uploaded into data.illinois.gov. So it's in a more usable format. Part of our strategic plan focuses on greater data dissemination. And so rather than putting it in just one format, we're not moving from iQuery to the Socrata platform and then shutting down iQuery or the hospital report card. Those are just different interfaces for, different doorways for other people to get access to our data. And we want to try to provide as many of those as possible. So right now it's built upon existing staff.
Rena?
So you do need, at the front end, you do need people to stand up the portal and then start putting the data sets in. And we are seeing a need, short-term, limited term, to build capacity and to be able to train people in departments on how to load the data. But we don't know yet if there's going to be necessarily ongoing need for additional FTE. We're trying to build capacity within the county manager's office as well, the analysts that we have, to build those data analysis, data science type of skills over time.
It does vary. It's one of those things that can start out small and see how it grows. we, in Auckland, the city has not assigned anyone to this full-time at all. It's a couple of people are responsible for it. City's engagement officer is helping push it. And so random people in IT are asked to publish data, from some departments are asked to publish data. And so there's no one person. That's actually a hard way to implement something successfully, but it's very common with open data. And so a lot of cities start out with no one in the role full-time. It's an assigned duty on top of things, and that can get hard. The ideal thing is in a lot of cities, Chicago, Philadelphia, there are people like Mark Head and Brett Goldstein that have actually been appointed as chief data officers. They're often political appointments, but essentially you're saying, if you buy the idea that, like Vivek Kundra used to say, open data is the rocket fuel of innovation. And if this thing is big and this thing matters, and it's kind of short-sighted to not invest in it. And so a lot of cities have said, this really matters, but it's really hard to change HR to create a chief data officer role. And so a lot of mayors are saying, I'm just going to get me one of those because those make a lot of sense. And you've got someone that can spearhead it, that can talk it up, that can do the engagement and really maximize the investment. So it can certainly start real cheap without multiple people. But over time, I think that will change as we see the value.
Thank you.
A question that comes just to mind from me from what you were saying. I'm curious how each of you handle or would handle misuse of data, because it's bound to happen. We know that if you put data sets out there, they could be misinterpreted and misused. And often I think that is a reason that some agencies and some data owners may say, no, we should only be releasing these to qualified researchers, people who we know are not going to misuse the data. And I'm kind of curious how you've handled that or what your response would be to that. But we'll start at the end again.
So I look at that through two different lenses. One is, in a lot of cases, we're publishing data through our new open data format, Socrata, and it was already available on our website somewhere else, maybe in a PDF or maybe in an Excel spreadsheet that they had to download and check back and wonder when it was going to be updated. So it's already out there, and so they don't really have that argument. They try to use that argument that, oh, well, they can do more things, they can manipulate the data more. I was like, they can do that now if they want, it's just a little more difficult. So people can still take data and misuse it regardless if it's data that you're releasing. Obviously, if you're being referenced as the site where they got the data, then you can certainly try to source that and make sure that they're accurately reflecting it. But I don't think you can be too concerned about controlling that, because once it's out, it's out. But the other lens is that that's in that vein of bad unintended consequences, right? And so, like, you mean good to get the data out there, but then somebody does something bad with it and they misrepresent and so on. And I think that it's important to also look at the good unintended consequences that can happen. So, you don't know what somebody can do with the data, and there could be a really positive outcome that can come from it as well. Somebody that you never would have thought would have been a stakeholder in the public health sphere, all of a sudden gets a hold of that data and does something really innovative and amazing with it. And until you liberate it, you can't really find that. So that's the other lens.
Great. Rena?
Yeah, I agree. I think there's more good that can come out of this by putting data out there. You can also be very strategic about what you put out there. That you're putting data out there that is for public benefit, that will achieve specific goals that you've set with the community. So you don't have to put just anything out there. Public Records Act requests are the easiest thing. Salaries. We asked our county counsel's office, what do we usually get asked for? Let's put those are the easiest things just to start.
There's a bit of an analogy with people do burnouts and speed on public roads, but we don't take public roads away from people. So it's a resource, and just because some people may choose to do dumb things with it isn't a great argument for not doing it. The other side of it is, if someone does something dumb or intentionally bad with your data, you have an opportunity to, like we said, engage with that person, that organization, and build a relationship with them. And that's someone that actually is interested in your data. And as a data geek, it's kind of cool when other people are interested in the data that I have or we release. And so it's a chance to actually build a connection with people, maybe publicly correct them. But what we see often is that people are concerned about really bad data getting out there in the first place, and the fear that I'm going to look bad because I know my data is not in tip-top shape. But we've seen over and over again that people largely positively respond to that and encourage and either clean up the data or raise it as an issue rather than say, I'm going to go to the media because the data is so bad. That really hasn't happened particularly much at all. And so the fears are valid, but in large part they tend to play out fairly nicely.
One other thing to add to that too is, if it's something that is, if you're concerned about how the data is going to be represented once it's released, and you say, you know what, it's really important that society, that communities view this data, the stakeholders who are receiving it view it in a certain format or way, then you have the opportunity to create that, but still provide it in an open format, right? So you can create a visualization through Socrates platform in various ways. You can show it as a map that you think accurately reflects that health disparity or reflects that access issue with healthcare services in a certain region. If it's a priority to you that people digest the data in a specific way, you still have the ability to do that, much like you would through anything else. But like somebody was saying earlier, enable the underlying data to also be exported so people can do it in other ways. And that's important, because then maybe, government, I'll admit, we're not certainly the best at coming up with the prettiest mobile application or the most effective one. Entrepreneurs and startups and a lot of others, understand user interfaces and other things better, and how, people are really going to use it and like to use it, the feel of it. If we release something, a lot of times it's very clunky and very government, it looks like it came from a government agency, right? So the idea is, if it's very important, sure, we roll out with a hospital report card, mobile application, or even just our web interface that displays the data in the way that we think at a minimum needs to be out there. But then you still enable others to come up with maybe a better product that can replace if society wants to choose to use that instead, or pay a premium for it, or whatever it may be.
All right, that's a great point. Other questions? Up here in the front.
For your next project, if you had two choices, you only could pick one, would you take on the project that opened a data set that had a lot of before and after measures around it so you could really demonstrate the value of opening up that data? Or would you take on the really awesome data set that a lot of people in the community are really, really excited about, but maybe you can't, or maybe you don't have some of the operational measures before and after to make to really show the value?
I would go, it depends on where you are in your walk with open data, as far as how far along you are. Because I could turn that great community issue, I could make a hell of a good story with that, and that would be just as convincing as A/B testing of before and after. So you could actually make the most of a community issue that yielded great results with open data that wasn't very measurable. But again, it depends on where you are and what the biggest goals for you are. So if you need to show gain, say for executive support, then do the first one. But if you want to do the most good, and newspapers and press love great stories more than they do before and after. So it depends for me on where we are.
I would do both. One, because the before and after thing, we all need to know that anyway. If you're a manager and you want to be able to show whether or not your program works, you got to have that data anyway. And now is your opportunity to show it more visually and tell that story. And if the community wants it, we have to work on getting it.
I'd say we're constantly faced with choosing priorities, and I mean, it's just the reality of it. We have too many things on our plate to be able to do them all, and specifically do them all at the same time. So we're always having to choose what are we going to do first. And in a situation like this, not to cop out, but I think it would depend on what the different issues were and how did they relate to our strategic plan. I know there was some reference to strategic plans earlier, but if done right, a strategic plan should be kind of the guide and light for the agency and help you justify the priorities and the decisions you make. It aligns with this component of our strategic plan. If it doesn't align with that, if it doesn't align with your mission and overall what you're mandated to do, then it becomes the second priority. You still work towards it, if it's that one that the community is demanding for. If it's not within the strategic plan, if it's not a mandate, but the other one is, you have to go with the mandate. You have to go with align with our strategic plan, and then work on the other one next. So.
Back there.
I know. We just rolled out one, so it's like, no.
One question that has that I've been thinking about and sort of came out of our table discussion was between the availability of open data and then the really incredible, interesting stories that Brian told us that led to some of the new applications, et cetera. There seems to be like the contextualization needed and sort of the ability to analyze it and come up with something practical and useful and impactful. And what sector, other than the anecdotal examples that Brian came up with, will be, and urban strategies, which I'm familiar with, of course, but is going to kind of play that intermediary role? There's foundations like California Healthcare Foundation that have taken a focus. There's the for-profit sector that could get involved here, like the venture capital and other sectors. But, to also think about that, I just sort of raise it as a question, and I wonder, in your experiences on the panel, what would be your best case scenario and what do you see happening?
Which city are you from?
Oakland.
Then you have the easy answer.
Yeah.
So there are, across the US, there's an initiative called the National Neighborhood Indicators Partnership. It's neighborhoodindicators.org. So there's 36 cities that have organizations like ours, which are essentially data intermediaries. So they're groups that get local context, they're reasonably politically savvy, but they can analyze the heck out of the data, they can get it into a community absorbable format. So there are a lot of organizations like that, but a lot of it, like Chicago's data intermediary closed last year, which shocked us. But so some cities are losing that capacity while it picks up otherwise. So there's now other organizations in Chicago that can do the stuff that some of the traditional data shops weren't as relevant anymore. And so it changes, but there are a lot of nonprofit, researchy, wonk shops that can do this stuff. A lot of them actually are not yet in the open data fold. They're resisting it because they're used to, and we thought this way, is that some of their relevance was in their ability to control data as that intermediary, and they have to accept that that's changing and that's no longer their biggest asset. Their asset is that they can explain and can analyze and contextualize the data, and that's really valuable. So I think that's a changing field that the foundation sectors definitely have to be aware of, is that what does it mean for more data to be out there when people can't actually do anything with it with outstanding capacity? So that's a really big question for us.
Anyone else want to take that?
Yeah, so, I don't know if the county or government has a role in kind of this whole new area of data science. And if we're all trying to improve the community, I think it takes more than just the county to do that, right? So the cities, foundations, the schools, businesses, I think we all need to, once we get to what are the most important things that we're going to measure, then we all need to get together to figure out what's the best way to get that done. I don't know if it's going to get really expensive if government is the only one that's going to step up to take a look at this new area of data visualization and analytics.
Yeah, I'm not sure if I completely understood the question, but I'll take my best stab at it. I think that the federal government has been kind of leading the way. Brian, Damon, Todd have been doing an amazing job in kind of really leading the way for establishing the need for open data, the benefits of it, and some of the standard approaches for it. I mean, we've stolen a lot of things, and we're actually going to be stealing a lot of pieces of their open data plan that they have out right now. And I know New York also has been very, first of all, very collaborative with HHS, but then also has been willing to share that with us as we're a few steps behind them, and we're certainly willing to share our experiences as well. But the foundations, they're already figuring this out. Trusts, a number of not-for-profit organizations out there. Robert Wood Johnson Foundation is a huge supporter of this, and they're encouraging innovations and getting people to open up their data and do more with it. The California Healthcare Foundation here, I know, is obviously a very large supporter of the effort and trying to hold people accountable to move in that direction. They were a co-sponsor of our event in Chicago and in Illinois as well back in November. So, there's a number of those advocacy organizations that want to see it, and they're pushing for it. I think the biggest challenge is going to be establishing those data standards across the board that everybody's going to want and need, and thinking about it from ultimately not trying to define who the only users will be of those data sets, but making sure that it's set up in an infrastructure where you're collecting the data on the front end. And that's going to be the biggest challenge for our agency. There are a lot of data sets we want to open up, but the way it's currently being collected is so outdated. I mean, we are still very paper heavy. And so we got to just get it into an electronic format in the first place before we can even release it in an open data format. So that's going to be the biggest challenge is defining those data standards across the board, not just for health and human services, not just for government agencies at a state or local level, not just at a federal level, but in a way that foundational researchers and others, and I know there is some work on research organizations and others that try to set some of those standards, but I think establishing those as a state policy governments, that's going to be the biggest challenge.
And I'll just take a stab at it too, just from a representative of the philanthropic sector. So I think that's a really good point about the need for intermediaries. It's not just incumbent on government to, the innovation doesn't just happen. And I think foundations, from my historical perspective, have always been very involved with wanting to provide better access to data. And often a foundation's response to that was and still is to build a data portal of some kind. Robert Wood Johnson Foundation, Kaiser Family Foundation, my own foundation, we all are part of this. And perhaps we historically did that. I don't know if we thought of it this way, but maybe we historically did that because government, and this goes back 10, 15 years, wasn't necessarily stepping to the plate of doing a good job of releasing their data. So foundation said, let's do it. But that's changing now. And what I'm hearing from foundation colleagues is that they're really interested in this stuff. I mean, I know of a number of foundations besides my own, Knight Foundation comes to mind, that's really interested in harnessing the data and helping to leverage use of the data, whether it's through code-a-thons or challenges or other means. And by that same token, I know we're going to hear a little later today from Code for America, whose whole model is based where they put fellows into cities and have the cities help create interesting innovations through these fellows. Well, they need foundation support or support from foundations and others to help pay for those fellows. And often that comes from community foundations and others. So the philanthropic sector, I think, is willing to step up to the plate. I think they probably, some need some education on what this is all about. So, other questions we have?
I have a question back here. You've all spoken about some of the challenges of designing and implementing the programs. I'm interested in what it feels like inside an organization when you're doing this, and how do you communicate this to people both above, next to you, and below you in the hierarchy. How do you talk about this, and how do you engage people to want to pay attention and spend time on it within your organization?
You want to start, Stefan?
So that was a big challenge for us, the change management aspect of it. And with any IT project you're trying to implement or pursue, that's always a big challenge. So we're an agency of about 1,200 people, modestly sized. I'd consider us a mid to large agency in our state. But we have many data stewards throughout the agency, and getting them to buy into this was key. So 2011, when we first told them, get as many data sets as you can into data.illinois.gov, we got a lot of attention because we, pushed real hard from the top down, for about a month and a half. And then for the following 9 months after that, we had, I think, 0 to maybe 1 data set that was uploaded. So they did their assignment, just another thing that the top's telling us to do. They did it, and then they went back to, their other efforts. They didn't buy in, they weren't sold, they weren't really, educated on the benefits of it that they could, achieve. So the second time around, and this time we're starting from more of a bottom up. And a big reason why we had the open data forum back in November and the public health data palooza was really to bring a number of our data stewards. I think on the second day we had 150 attendees, and about a third of those were our staff. And we embedded them alongside entrepreneurs, data researchers, and others, and had them sit in these kind of brainstorming sessions, had them go through the same workshops, seeing how other people are interacting with their data. And that level of interaction really got them excited and jazzed. And I won't say maybe all of them completely bought into it by the end of the day, but a good portion of them. And many of them were thankful that we allowed them to participate on an event that was a Saturday, which they traveled up to Chicago for on their day off, to be part of this, and they went back to their offices, and then you're seeing, since then, we've had a number of other data sets that have been added in, just because they understand it. They understand it a little better, and they're excited about it. So it's creating those small wins. It's getting them to, to see it and really become champions throughout the agency, and that way they can start to do it, because you can't manage every single data, stored across the board. It's not effective. You got to get buy-in. You got to get excitement. So.
For us in San Mateo County, it was easier for us because of Measure A, because we did get the half-cent sales tax, and it was a priority for us to get the open data portal up and to show goals. Now, moving from there, so that's $65 million out of a $2.2 billion budget. It is like conversations all of the time. You're very focused on performance. And what I hear from our departments is that, and then you have some you're looking for champions all of the time. You have to. It's like you have department heads that are gung-ho about it, and others that don't want to do it at all. And eventually, over time, this is a multi-year investment that we all have to make. And then you also have to focus at the employee level. Performance happens at the individual contribution level. So we're also trying to address as part of performance management, goals have to align from employees all the way up to community. And so that's the training our managers and our supervisors to use data to manage performance. So there are a number of different tracks that you have to take, but you just have to keep at it. It is culture change.
So in Alameda County, the big internal angle for this was this will actually improve data sharing within agencies. That was both the hook that got them to do it and the internal motivator for people, was that it's really hard to get agency data shared because it costs a lot of money to build integrated data systems, and they're very time consuming. They're necessary, but publishing data for the public also means other agencies have access to it, and that's a huge win. In Oakland, the city's struggling with this. The city's lost a lot of funding and lost a lot of staff, and has decent leadership around this, but needs more. And so we realized that at a city camp last year, most of the city staff present didn't have a clue that the city had open data on the books and has been doing it. And so the civic hacker group that I'm part of decided that they would actually run a PR campaign inside City Hall for city staff to get them aware of it and excited about it, because we all get it and think it matters. But if people inside that agency don't, then it's going to die a really slow, horrible death. And so the community is saying, this isn't good enough. Like, we want people to be excited about it. We're going to try to get people excited about it inside City Hall. So come back in 12 months and ask me if that works or not, but that's our idea.
So I have one final question for each of you. And I'm kind of curious, if you were starting over again, or for that matter, advising another government, such as the state of California, on open data and how to move forward, what advice would you give? What would you do differently that you didn't do the first time around? And maybe we'll start again.
I mean, I already alluded to this earlier, but I think that starting from the bottom up is important in making sure that you develop some kind of a package or toolkit that helps educate the people you need to buy into it, and figure out how to immerse them in it in a way that they're going to find exciting and want to champion it. I mean, our state is either dead last or second to dead last for the amount of state employees we have per capita. So every agency is extremely understaffed, and even though we're near dead last, every other state still also is very under-resourced and understaffed, right? So I know all your government agencies are dealing with the same issue. So they're not doing the job of 2 or 3 people, they're doing the job of 10 people. And try to let them understand and the benefits of it by saying, look, I understand this is another task on top of all your other duties, but if you do a little extra work on this now, eventually it's going to reduce the other amount of duties that you have to do, because it will, help them see the operational efficiencies that they can achieve. You're not going to spend your day performing FOIA requests anymore. Now you can just have it automatically populated, and then the PIO can push them straight to that website, and staff can just work on doing program analysis and other things. So helping them understand that it's going to ultimately reduce their administrative burden, and that it's not going to be just one more thing on top of their shoulders.
Good point. Yeah. Reina?
So we're still really early on. But I mean, I could see where the whole idea around data standards and having some uniform guidelines in place, so when we're all starting to put data sets on there, that things aren't getting too old, or we have to make sure we keep things current. I think we can do a lot better job of doing that now, because it's starting to look kind of cluttered. And so we need to do it in a more organized way. And then also we want to work towards more benchmarking too. So whatever it is we're gathering in terms of data, we should also make sure that we'll be able to compare that to other jurisdictions and regional, statewide, national levels.
I think we're early on in Oakland as well, in Alameda County. I think one thing that I would definitely want to do differently is it's predicated on knowing though, right? If we knew enough about user-centered design, when we rebuilt our mapping tool, we would have completely abstracted the idea of open data into a separate system. So right now we have a mapping system, which is where you get the data, and it turns out that it's actually a little confusing for people. It's just like having your city government with 20 departments and a bit of data on each site. It's actually really hard for people to find that stuff. And even though we have one website now in Oakland and one for the community where the data is available, I still get phone calls from people looking for data. And so separating the data early on, not embedding it in other systems and mapping tools, but getting a clear, separate website, clear domain name, simple visibility matters a lot for people being able to find it. Google doesn't find your data in most of the systems that people are publishing their data in. Like if you search for it on Google, you will not find it in most cities. And that's a problem because it means that people, even if you have the tool, people still don't find the stuff easily, which creates a barrier to a lot of good things. And so for us, it would have been actually thinking about how to make it clear and obvious that this is where the data lives for the city and not confusing it within any other system or website or whatever it might be. So clear, distinct visibility of the data.
Yeah. And actually, just to build on that, so I know HHS has done a good job. They want to ultimately connect to all the other open portals that are out there, and so you can go to HHS's, just healthdata.gov and access Illinois data. So but first we have to put it in an open format that they can easily connect to it through. So again, whether they go through the federal door or the state door, they can still get the data. But we have that, single site, data.illinois.gov. Matter of fact, there's actually a single site for the county, the city of Chicago, and the state of Illinois that all data feeds into. So if you live within the border of city of Chicago and you want to get state, county, or city data, you can get it only from one place, or from that one place if you wanted to. But also there is an ability that once you put it into that single source place, you can also create easier pathways to that data through microsites. So, for instance, the state of New York, their health department has kind of a health page of just all health-related data. Now, all their health and human service agencies kind of fit under one umbrella, so it's a little easier for them because they can mandate it across, all their programs to do that. In our state, we have data.illinois.gov, and then it's, just individual agency data sets. You can look it up by, certain tags and whatnot. But we're going to be building a microsite that's going to be specific to healthcare data, specifically in Illinois. Most of it will be our data from public health, but it'll also be a landing spot for the other health and human service agencies, our sister agencies, that basically anybody who's interested in health data specifically can go there, or they can access it through the general page, data.illinois.gov. So that's also important. Like even though you put it on the one port, you can still find ways of also funneling people to the data. If they're interested only in that.
Well, I want to thank our panelists. I think it's great. We've gotten the perspective from earlier today with Brian at the federal level, the state level, and of course the very local level, a county and city perspective. So I really want to thank our panelists for offering these perspectives, great insights. And I want to thank all of you for your questions.